Anaphylaxis, what is it? Signs and symptoms that somebody is going into anaphylactic shock? And what are you going to do to help that person? There are many things that people have severe allergies to. The most common one being peanuts. Some of the other common ones are fruits, strawberries, bananas. Sometimes it's medication, penicillin. Sometimes it's cats, dogs, bee stings. Regardless of what the cause is of that person's anaphylaxis is no different. You're going to use auto-injectors exactly the same way, using the medication that they have to treat their shock. Now, the recognition of anaphylaxis. All of a sudden, what happens is there's a sudden drop in blood pressure. And when that happens, they start to swell up. And it's really difficult to breathe because the throat swells up. And you can imagine if your throat swells up, trying to get oxygen in is a massive problem. They may start coming out in hives on their body. But whatever their trigger is, they need help from you. Now, there's 3 different types of auto-injectors. Now, not many people know this. Most people see this, the most common one, which is the EpiPen. But I'm going to demonstrate to you how to use all 3 of them, should you ever have to do so. Ideally, you want the person to be on the ground. They may be lying, but on the ground and their legs straight. The reason why we want to do this is because we want to make sure that we get the needle into the part of the body that is the most effective. Now, I'm going to do this to my own leg because it really doesn't bother me. If I was to grab up here, I'm grabbing. What am I grabbing? It's fat. I know, it's fat. So we don't want to inject directly into fatty tissue. The place that you're going to inject this auto-injector is what we call the seam line. So if you can imagine an imaginary seam down your leg, and it's here where the needle's going to go, because here you can't grab it. This is where the muscle joint is, and we want to get the needle directly into the muscle because that then gets into the bloodstream even quicker. This is the auto-injector, and I'm going to demonstrate this one first. Now, all of these auto-injectors come, and on the back of them, it tells you how to use it. So if you've never used one before and you're a bit frightened and you need a recap, briefly, quickly read it. Now, the blue part is the safety cap. We need to remove this before we can put it into the person. What you don't want to do is put your hand in the way of the orange part, because this is where the needle and medication is going to come out. So we're going to take the cap off, and it's important that we hold the EpiPen at a 90-degree angle and approximately 10 centimeters away. Firmly, you're going to inject it in. You heard that click. That means that it has been activated. Now, on the back of some of these auto-injectors, it says hold it in for 3 seconds. Hold it in for 10, just to make sure that you get all of the medication out. 8, 9, 10. After 10 seconds, release. Here's the good news. You are not going to see the needle from here. It is in a protective casing. Once you've put the medication in, just give it a little rub, and that then stimulates it and gets into the bloodstream very quickly. Now, these auto-injectors work extremely fast, within minutes. Hopefully, you're going to see the inflammation relax. But after 5 minutes, if the person is still struggling to breathe, and if that medication hasn't worked, a lot of the time the person will carry a second auto-injector. If they have a second one, after 5 minutes, you're going to inject it. So remember the blue safety cap. I remember it, sky is blue. That's how I do it. So taking off the safety cap again to the second one. Again, holding it at a 90-degree angle, 10 centimeters away. You hear that click, that's it now injected. Hold it in for 10 seconds, 8, 9, 10, release and give it a rub, and that will get it into the blood even quicker. Now, it's absolutely essential that you call emergency services. This is an emergency. Even if the medication works, the paramedics will come, they will take the person into hospital just to run a few checks. The reason being is it's a bit like an earthquake. You have the main event. There may be smaller aftershocks, and they need to be in hospital anywhere between 4 and 6 hours just for observation. And if something does happen, they're in the right place. There's 2 different dosages of an EpiPen. There's the junior and there's the adult. It all goes by body weight, but it is all the same medication, just a different dose, which is adrenaline. So that's the EpiPen. The other auto-injector that we see is called the Jext. Inside, again, is exactly the same medication. It is adrenaline. But this is a little bit different how we use it. Again, on all of the EpiPens, or the Jext, sorry, they will have instructions on how to use it. If you need to remind yourself, then just have a brief read. But this time, I think of the yellow sky as in the sun. And this is the safety cap. Again, do not put your hand under here because this is where the needle's going to come out. Take the safety cap off. Again, it's going to be down the seam line, but this time you're going to hold the auto-injector onto the person's leg and then push. You hear the click? That is the needle gone into the person. Hold it in, I say 10 seconds, just to make sure you get all of the medication out of the pen and into the human. After 10 seconds, release. Give it a rub. Same rule applies. Once you've called emergency services, when they arrive, you're going to give them the used auto-injector and they will dispose of it safely. If the medication hasn't worked after 5 minutes, if they have a second one, you're going to inject it to them once again. And it really doesn't matter which leg. You can put it into the same leg if you wish. Now, the third auto-injector is called the Emerade. Now, this was really quite popular at one time, but it went off the shelves for quite a few years, just down to supply, but we're seeing it coming back. The difference with this one is there's 3 different dosages. So if you've got a real young, let's say baby, then you can get the dosage suitable for them. You then have the junior one and the adult one. It's got exactly the same medication into it as the other 2 that I've just showed you, and it works the same. With this one, it's also got a safety cap, but it doesn't have a different color. Okay? Once you take off the safety cap, the needle is going to come out of the same end as the safety cap. So be mindful, do not put your hand in the way. Again, this one is going to be a 90-degree angle, but hold it onto the person's leg, on that seam, that invisible seam. And all you're going to do, and it's really quiet, this one, it's a little click. Listen. Again, hold it in for that 10 seconds, making sure that you get all of the medication out of the auto-injector and into the person. After 10 seconds, remove. Again, put that cap back on and hand it to emergency services when they arrive. Those people that suffer from anaphylaxis, when their pen goes out of date, then they practice using it into an orange because it's representing the same texture as what a person's skin is. It is the responsibility of the person who has the medication to check the dates. All of these auto-injectors have a little clear window so they can see in. If it's murky and it's got maybe little speckles of black in it, that is not fit for use. They absolutely have to contact their GP and get fresh medication. If that person doesn't have their auto-injector with me, you're just going to have to stay with them and call emergency services. But fingers crossed, most of the time, these auto-injectors do save lives. I'm Sarah, owner and trainer of First Aid at Work, Aberdeen and Aberdeenshire, making training fun, engaging, but most importantly, memorable.